What have you thought when you think about the risk? Because there's never been anything like this for, so as a phase 1, 2 trial, it will be really an experiment in assessing safety first and foremost, and then secondly, efficacy. So how have you thought about that?
To be honest, risk-wise, I'm not I'm not adverse to any potential risks, because without it, the risk is too great, right? Without it, um, she won't live, into
Mhm.
her like young adolescence.
Mhm.
So to me, um, I know that there's enough um, going on behind the scenes to that is it being done safely. I'm not afraid that like something's going to happen and then immediately there's like a respiratory arrest or something like that. I'm not concerned with that. I think my biggest concern with risk is maybe doing, let's say, she can be included in the trial and I choose to say, yes, I want my daughter to be a part of this. And then what is that treatment going to do for her?
Mhm.
I think my fear of like that risk factor is more, I only I only want to do this for her if it's the right thing for her in the very long run. And I don't know that we'll know those answers before it's time to decide.
Well, that did make sense. Well, what I think you were touching upon is, do you put her in this trial, or do you see if there's another one that's more effective? How do you know that this is the most effective one?
Yeah.
Is that what you meant?
Well, that's another one though.
Oh,
That's
oh, that's another thing.
because they also learn from this one, and then maybe in a year or whatever they perfect dosing or they tweak this or tweak that. And then if you hadn't done it the first time, because I don't think you can do it again, then maybe if you just waited and instead of being 1.5, maybe she was 3. But so there's definitely that, because this would be the very first time and extremely experimental. And again, as a parent, with this hopeful outlook, it's like, this is a treatment. No, it's not. It's not a treatment. This is a trial with a hopeful treatment.
Yeah.
Um, but like, yeah, yeah. Um, so that's another thing. I think my thing is more, and this is hard, but and this is going to be one of the harder decisions if it's a decision that I have to make whether or not I want her to be included, because I know that there's another decision up to the, just the protocol and whatever criteria, right? But is okay, what do they hope to see happen? What improvements do they hope to see? Is there any, um, you know, will she be able to walk with a walker or talk or anything like that that maybe kids, without the treatment won't be able to do? And what are those improvements and what are those things? Because in my mind, there's, I don't know, I'm going to weigh those when it comes to deciding whether or not it's something we're going to move forward with, which is hard to think of because if you don't do it, they're definitely not going to, right?